Welcome. My name is Carrie Winterdahl, and I'm the Digital Health Literacy Coordinator for Eastern Illinois University, representing Booth Library, the Department of Public Health and Nutrition, and the School of Communication and Journalism. Today's digital health literacy topic is advanced care planning. Thank you for joining us today. Anyone at any age can experience a medical crisis that can result in the inability to make decisions about their health care. Even if you are in perfect health, planning for your future health care is vital to assure receiving the medical care you want if you cannot speak for yourself and your family and doctors need to decide on your behalf. With advanced care planning, you need to learn about the different healthcare decisions that need to be made, document your preferences, and let others like your family, friends, and your healthcare providers know your wishes. These wishes are put into an advance directive, which is a legal document that is effective only if you are unable to speak for yourself. A disease or severe injury from an accident can leave you debilitated, and the advance directive helps others know what type of medical care you choose. You can express your desires related to end-of-life care in an advance directive. This is a living document that can be changed and updated as your health changes. The types of care you want, who you choose to make decisions on your behalf, and the ways you choose to share these decisions with others are things to consider. Letting these important decisions be known will take pressure off your family and give you peace of mind. Having concerns about your care if you were to become critically ill is normal. Most people do not like to think or talk about critical care or end-of-life decisions, but the best time to plan is when you are healthy. It is important so you can make those decisions while you are able. If you have any questions about your choices, you can talk with your doctor. Health insurance companies and Medicare can also help answer questions as well as supply you with the advance directive documents to make your decisions official. If you want to do your own research, a safe website to use that has a lot of great information is Medlineplus under the National Library of Medicine. To access Medlineplus, use the web addresses on this page. There are many things to consider when creating your advance directives. Your care goals and expected outcomes in certain situations, the different care treatments you would like or not like, using palliative and hospice care, where you would like to live if you require assisted care, and where you would like to spend your last days if that is needed. Palliative care and hospice care both offer comprehensive comfort by relieving physical and psychosocial stress, reducing symptoms and pain for the individual, as well as providing family support. The main difference is with hospice, treatments or a cure is no longer being pursued because the side effects exceed the benefits. Palliative care can be used with or without seeking active treatments or a cure. Another big difference for those on Medicare is the way palliative and hospice care is covered. More than 90% of hospice care is covered by Medicare. The individual is required to meet the hospice Medicare guidelines to receive hospice care. Palliative care does not have these same requirements. If you no longer can support yourself safely at home, some options are assisted living and skilled nursing facilities. Both of these facilities provide long-term supportive medical and social care, but the difference is in assisted living, the individual manages their own life, but may be assisted with activities of daily living or ADLs. In a skilled nursing facility, individuals receive continual nursing care and assistance with most or all ADLs. You can ask your doctor for information on this topic, or if you want to do your own research, Medlineplus has information at the links here. You can also decide which emergency medical treatment should be used to keep you alive if that is needed. Doctors use several different mechanical or artificial ways to sustain life. Decisions that may come up are related to using CPR, ventilators, artificial nutrition, artificial hydration, and comfort care. CPR stands for cardiopulmonary resuscitation. CPR is an emergency technique that can save your life if your heart stops beating or has a rhythm that is not normal. This technique requires someone to perform quick, repetitive compressions on your chest forcefully while breathing air into your lungs. The pressure from this force can cause broken ribs or a collapsed lung, but it helps move the blood around your body until the heart starts beating normally or emergency help arrives. Often this technique is used at the same time with an auto external defibrillator or an AED machine if one is available. When using this machine, pads are placed on your chest and the heart rhythms can be analyzed to see if an electric shock can be given to help the heart beat normally again. Ventilators assist in breathing by forcing air into the lungs with the machine that is connected to a tube that is put down the throat and into the windpipe. Doctors may use the term intubation, which means placing a tube in the throat. This is uncomfortable, so sedatives are used to keep you relaxed while on the ventilator. If a ventilator is needed for a long time, the doctor will perform a surgery to place the tube directly into the windpipe or trachea. This process is called a tracheotomy. This is more comfortable, but the air that is breathed out does not go past the vocal cords, leaving you unable to talk without special assistance. If you do not have the ability to eat, a tube can be placed in your nose that leads to your stomach where you will be fed. This can be surgically placed into your stomach directly if it is needed for a long time. If you do not have the ability to drink, fluids can be given through an IV. A thin plastic tube will be placed into a vein, delivering hydration to your body. Artificial nutrition and artificial hydration can help you when recovering from a long illness, but does not sustain life for a long period of time. This can be harmful if the body is dying and unable to use the nutrition and hydration in the way it is needed. Comfort care is anything that can be done to relieve suffering and soothe you while following your wishes. Managing breathing, restricting medical tests, offering emotional and spiritual support and counseling, and offering medications that help reduce and control pain, nausea, constipation, and anxiety is all part of this care. To learn more about CPR, ventilators, artificial nutrition and artificial hydration, comfort care, and end-of-life care, visit Medlineplus at the web addresses here. To get started with advanced care planning, think about what care you do and don't want in a medical crisis. You can talk with your doctor about your options. Your doctor is familiar with you and your current state of health, which may affect your future health outcomes. An example of this may be if you currently have heart disease or high blood pressure, what types of decisions would you or your family need to make if you had a heart attack or stroke and needed emergency or long-term care? It is okay to ask your doctor to help you understand and process your decisions before you create your advanced directive. Your personal values are most important when planning your future care. Is quality of life most important aspect, or do you want to live as long as you are able? Think about things like how you would feel about being paralyzed or in a permanent coma, and would you require a ventilator or artificial nutrition? Is that something you would want? When you are planning, think about what things give your life meaning. Do you want to live as long as medically possible to see important life events like a wedding or to spend more time with your family? Would you want to extend your life if it was of low quality? If your heart stops beating, would you want CPR? Or if a stroke leaves you mentally or physically impaired, would you want special treatments just to keep you alive? If you were permanently unconscious, would you want to be placed on a ventilator and receive antibiotics if you get pneumonia? These decisions are okay to discuss with your parents, spouse, children, or support person. Having these conversations may help you decide what you want for yourself and for the people you love. An advance directive has two main parts: a living will and a durable power of attorney for health care. You can also supplement your advance directive with certain documents. You have a choice of which documents you create depending on your decision. These documents include the living will, durable power of attorney for healthcare or healthcare POA, the Do Not Resuscitate Order or DNR, a Do Not Intubate Order or DNI, a non-hospital DNR, the Physician Orders for Life-Sustaining Treatment or POLST, and organ and tissue donation. Now, what do these mean? A living will document shares your decisions of how you want to be treated if you are permanently unconscious or dying and are unable to express your wishes. This helps your doctor know what type of emergency treatment to offer based on what you do and do not want. A durable power of attorney for healthcare or healthcare POA legally names a healthcare proxy or a person you designate to make medical decisions on your behalf when you are unable to do so. Other names for a proxy are representative, surrogate, or agent. This person should be someone who knows and understands your healthcare wishes and is capable of making them when you are not able. You can have both a healthcare POA and a living will. The Do Not Resuscitate Order, or DNR, instructs the medical staff in a hospital or skilled nursing facility that you do not wish for CPR or other treatments to be used to return your heart to a normal rhythm if it beats abnormally or stops. If you do not have a DNR order, medical staff will do whatever it takes to restore your heartbeat and breathing. The Do Not Intubate or DNI order instructs the medical staff in a hospital that you do not wish to be placed on a ventilator. A non-hospital DNR is just as it sounds. It instructs the medical staff that you do not want an attempt to return your heart to a normal rhythm if it stops or is unable to return to normal by using CPR or other treatments when you are not in the hospital. The Physician Orders for Life-Sustaining Treatment, or POLST, documents a variety of end-of-life care treatments. This is different from the DNR, which only gives instructions about CPR wishes. The POLST takes in consideration both your wishes and the doctor's medical evaluation. If you choose to donate your organs and tissue, it means when you die, your healthy organs or body parts can be transplanted into someone who needs them. Usually organs like the heart, lungs, pancreas, kidneys, corneas, liver, and skin are donated. Organ donation does not have an age limit, and you can include this wish in your advanced care planning documents or add your wishes to your driver's license. It is important to let others know that you want to be an organ donor, so this can be expressed if needed. Organ donation is considered a gift of life, and there is no fee associated with the procedure. If you want to be an organ donor, but have also requested a DNR order, it should be documented that the wish to donate overrides the DNR because machines may be needed to keep the organs working until the medical staff is ready for the organ transplant. If you choose to have a healthcare proxy, carefully consider a person who understands and shares your values and views. A healthcare proxy can be a family, a friend, a lawyer, a person in your spiritual community, or a medical professional. You can also name an alternate person as well in case your first proxy is unable to be present. It is your choice as to how much control your proxy has over your medical care, and your advance directives can dictate these decisions that they are allowed to make. It is also important to discuss your plan with your proxy and make sure they are comfortable with this role. If you choose not to have a healthcare proxy, make sure you detail all of your decisions in your living will. After you've talked with your doctor, family, and friends about your decisions, chosen your healthcare proxy and alternate, and developed your plan, it is time to fill out legal forms detailing your decisions. You can seek a lawyer's assistance, but it is not a requirement. If you do lose a lawyer, they will not have the expertise to give you medical advice. That is something you will need to talk to your doctor for. For Illinois residents, resources, laws, rules, and templates for these documents can be found on the Illinois Department of Public Health at the web address found here. After you prepare your advance directives, give a copy to your healthcare proxy, alternate proxy, and your doctor, who will store it in your medical records. Keep a copy for yourself and let your family and friends know where it is. Make sure you track where the copies are in case you need to make changes later. Every few years, review your advanced care plan and make updates if anything changes in your health, your marital status, or in your proxies. If you make changes, be sure to change all of the copies that you have. It can be hard to talk about your advanced care wishes with the people you love. Some find this type of conversation upsetting or do not want to think about critical care or death, but it is an important conversation to have, and it is part of life. Making your wishes known can also give you and your loved ones peace of mind. Having a plan in place and being well prepared will reduce stress and anxiety of the unknown. These conversations can help comfort you and your loved ones with the knowledge that you are both prepared with what may happen in the future. It is important to plan and be prepared. If you are in a medical crisis and cannot speak for yourself, and you do not have an advance directive or plans made, your state will appoint someone to make decisions for you. This person can be your parent, spouse, or children, but if you do not have family, the state will designate someone to speak for you. This designated person will act in your best interest, but will not know your wishes. It is important to remember that an advance directive is used only if there's a possibility that you may die and emergency or extra measures are required to keep you alive, but you do not have the ability to decide your care. The advance directive allows your decisions about your care to be known to your family and healthcare provider. The future is unpredictable, and no one knows for sure if they will ever experience a medical crisis where they are unable to make their own decisions about their care. Having an advance directive gives you the power to make your wishes known when you are unable. This can be reassuring and comforting not only to you, but to your loved ones. For more information on digital health literacy, check out our topics on the Eastern Illinois Booth Library Guide site. Thank you for joining us today.